Valenzuela from Alliance Physical Therapy. I know that technology is a good thing, and we certainly utilized it in our conversations earlier. You've been using it at the office when you had to maybe do some telehealth with your patients, but there is nothing like that face-to-face contact that you're safely able to do at Alliance Physical Therapy.
Yeah, I mean, and with what's going on right now, it's really difficult the isolation has made it really difficult on all of us, and just getting out and getting to physical therapy again is helping a lot of people.
You took this almost personally a little bit. I'm going to speak for you a little, and we're going to talk about some techniques that you're seeing great results with. When all this happened, not because you weren't obviously wanting safety for everybody, but part of that safety was wanting to make sure that the patients who need physical therapy not only had access to it, but the peace of mind to know that they were safe in getting that access. So y'all took a lot of steps, Alan, to really reassure your clients that they're protected.
Absolutely. I mean, we followed all the guidelines, and we're still following those guidelines, and we go way above and beyond. I mean, we have a fumigator disinfector that we spray in the facilities. So we know that there's a lot of people out there that are concerned and they're afraid, and I hate that. I hate that we're living in this type of an environment. But Alliance has chosen to take the high road, and that high road says that we're going to do everything possible to keep you as safe as possible.
So usually when you and I are talking, it'll be about an injury that somebody has had, and we can still touch on that, but I want to talk about stress for a minute, because stress, if you carry a lot of tension, that can kind of create a problem within you. And who among us right now isn't carrying some stress, and we might not even realize it?
Well, we know for a fact that much of the pain that we carry or we experience in our life is stress induced, okay? And stress, that mental part that brings you down, has a profound effect on your whole body.
It does.
And so it can show up as neck pain, arm pain, back pain. Most of us, it's neck pain. Stress is a real strong agent to creating that pain in our neck.
Okay, I have it in mind then, so tell me if this is right. For really and truly, the last 5 or 6 days, in this part of my body, all back in here, it hurts, sometimes more than others, and I know what it is, but I can't get rid of it. Dry needling is something that y'all are able to do, that you were explaining to me goes deep into that muscle and remedies it pretty quickly.
So that's one of the things we do like about dry needling. There's a number of ways of reducing your stress or treating a muscle that has what we call a trigger point in it, or for most of us, common would be like a Charlie horse.
Yeah.
Okay, a muscle spasm. You can work those out doing manual techniques and muscle energy techniques. The beauty of the dry needle is that it's invasive, and I can get my hands on you and I can palpate around and feel for it and find the exact spot where that is, and then I can take that needle and I can drive that needle all the way down into that area. And when I do that, there's many ways to use that needle. I can leave it there for a while and let it just cook and get your body to respond to the needle, which the response we're looking for is for that trigger point to just relax.
You likened it, I think this is right, to a door being locked,
so
right?
You got a locked door, you can't get in, your needle is your key. Stick the key in the door, open the door opens. So with this, we want that muscle to relax.
Okay, so I have been using, you may have watched the show often and seen Alan on before, and it's been more than a year. He brings real practical things that you can do at home, and you had a tube sock and a couple of tennis balls. You used to put those in there, and then you can kind of roll, and the sock holds them in place. That way they don't run away from you.
That's right.
So I've been sitting on my sofa doing that, but this dry needling would let you find the exact spot, and you could really get down in there and release the activation point.
Yeah, and not everybody's response is the same, but the majority of people get a positive response and an immediate response, and that's one of the things about dry needling that we love, is you come in, you're in pain, you're all tightened up, the physical therapist evaluates you, diagnoses you, goes straight to the spot where it's at, puts a needle in, and maybe pistons it a little bit, gets it to shut down. We're looking for what's called a muscle twitch, where the muscle actually jumps, and after that jump, what we find is that tightness, that trigger point releases. And the patient feels that right away, and they may feel relief almost instantly. And that's the beauty of that type of treatment, because we all want to feel better immediately, right?
Right,
We
yes.
don't want to wait for it. The needle really gives you that advantage sometimes.
Okay, let's talk a little bit about appearances and the aesthetics of things. So for some people, hearing about dry needling, it might scare them a bit. Typically, you walk into a physical therapy office and you see tables lined up, and you see some weights and that kind of thing, areas where you're going to go exercise. Years ago, I had one of my daughters at the Gun Barrel location for Alliance Physical Therapy, and I remember walking in, and the first thing I saw, besides your pretty lobby, was this pool. It's a water tank. And I thought, what? But hydrotherapy, am I calling it right?
That's correct.
That's something that you see, water therapy, you see a lot of benefits from. That sounds fun to me, Alan.
It is. It's a modality that gives you an option that you may not normally have in a physical therapy clinic. And the aquatics tank is a single person tank. The beauty of it is, for us in physical therapy, is it doesn't take up a lot of space. So it's not like having a swimming pool and the maintenance of having a large pool.
And it's tucked away so that you're not out in the open for everyone to be gawking at you.
That's right. So there are curtains to close. But we find it's interesting you say that, because we find that 99% of all patients want to be seen.
Oh.
They don't want the curtains closed. I think there's something to do with that claustrophobia that occurs. Mm-hmm. They want to do their exercise. They want to feel like they're a part of everything that's going on in the clinic as well. So it's rare that people want to be enclosed.
Okay, let's talk about spacing. I know you've been talking about the guidelines, and I know when people come, I think that they still wait in their car, or can they come into the lobby?
So no, we generally still make most patients wait in the car. Usually we'll let one patient stay in the lobby by themselves, but once they're moved on, we let somebody else come in.
But you have enough space there that if you are, let's say, in the tank, in the aqua tank, and then there's somebody else going through something with the bands, they're very far apart.
Yeah, and the majority of my facilities are large enough that you can easily accommodate 6 people and even more with the guidelines.
Okay.
Now we generally don't have more than probably 3 people in the clinic. Maybe my really large ones, there's 4 to 5, but most of the time it's 2 or 3 people.
I only have about a minute left, and I do want to touch on one thing. You mentioned that tension and stress can have then even growing problems within your body. Early intervention is important, and even more important with physical therapy, because you're limited in how many visits you can have typically.
That's right. So with early intervention, what we're just saying, this is a preventive thing. Get it taken care of now before you have to choose between medications and surgery.
And with the dry needling, typically one treatment and you're done, or is it a series?
No, but that could happen. You might actually go in, get one treatment, decide you don't want to come back. You're the boss, right? But we find that usually patients have a lot going on, and they're there anywhere from 3 to as many as 12 sessions.
Okay, here's where you're going to find him. There are locations all across the viewing area, so the phone number is not a 423 number. You see that non-local number, because that'll get you through to everybody. But the website is nopainpt.com.
That's correct.
Always good to see you, my friend.
Same here. Thank you.
Hang in there.
Appreciate it.
We're back after this.
James, your car was pulling to the right, and you came